And joining us this morning are Dr. Shad Dabaghi from Gastroenterology, and also Michael, you a young patient who has battled cancer. So thank you so much, gentlemen, for coming in and joining us this morning. Michael, I want to start with you. If you could just tell us a little bit about your experience.
Well, being a younger generation, I was not expecting that, because usually colon cancer screening starts at 50.
Yeah.
And you know, it was real hard. I have stage 4 colon cancer and still working through it. So my message is, you know, colon cancer is one of the most common cancer, and it is preventable. So go get screened, go get early detection.
Talk a little bit about how you were diagnosed and some of the symptoms you were experiencing.
Okay, so I had cramps, and I went to see my family doctor, and it was he had thought it was gas, but it was not. It kept on lasting, and then the only way to find out what was going on was get a colonoscopy, and Dr. Dabaghi over here found out it was colon cancer. And
yeah, Dr. Dabaghi, talk a little bit more about your experience and what you see. Michael's case, not very common for his age, but it does happen.
Absolutely, and we don't have an answer for everyone his age. There's been no change in formal recommendations, because even though there's an increased incidence of younger people getting colon cancer, there's not enough incidence to change our screening recommendations. However, there are some signs that we should watch out for, and Mike had about 3 of them. He had abdominal pain, he had unexplained iron deficiency anemia, and his stool tested positive for blood. So those are some of the things that we can do to look for. Also, change in bowel habits. That's one other thing you can look for in this particular situation.
Because right now, you talked about the screenings, it's recommended for men age 50 and older. But if you are experiencing any of those symptoms, especially, you know, the severe stomach pains, the cramping, go see a doctor.
Absolutely. And also overt rectal bleeding.
Yeah.
That did not happen with Mike, but it does happen, and when people are young, they think it's from other causes, such as hemorrhoids. Just make sure it's checked out.
Yeah. And now, with Michael's situation, what does this mean for his family? Because he is younger, would they need to be checked out as well?
Absolutely. Starting at least 10 years before his age of 42.
Yeah.
All first-degree blood relatives.
How are you feeling now, and what's the latest?
We went through heavy dose of chemo and did some CyberKnife, and on the way to recovery, I believe.
That's good to hear. Any final words, a message that you would want to get out to viewers about colon cancer? Yes,
it's the most second common cancer in men and women. And for the most part, like Mike said, it is preventable if you follow the screening guidelines. That's the main message, that it is preventable for about 60 to 80% of cases.
Yeah, but people often don't get screened because, like you said, they may think it's something else. But if you're experiencing this, go in, get a screening.
Absolutely.
Yeah. All right. Well, gentlemen, thank you so much to both of you for joining us this morning.
Thank you.
We do appreciate your time. And we'll be right back.